we knew we had a lot of really great things. We knew we were doing things that would look after our people, that would prevent harm, but nothing was really within a safety framework or a system. So we needed to say, okay, well, how can we create what we've got and further develop what we've got to better integrate into our safety management system? So we put together a framework in which we wanted to work within, which is based on the Safe Work model as well as the WHSQ model: promote, prevent, intervene early, support recovery. And within that framework, we also added, because of the fact that we've got a really large workforce, and this is something that we do spend a bit of time on, we also added managing crises to our framework. So that's essentially what we wanted to work within. And we saw that, you know, managing a crisis really, really effectively and having a number of individuals, of which, you know, unfortunately people do experience mental health crises, and managing those appropriately and effectively also feeds into your prevention and your early intervention and your supporting recovery approach as well. So we took those 5 components. We spent a lot of time initially, so throughout 2018, 2019, getting people on board, really educating our senior leaders, really making sure that people understood what is psych health and safety, what is psychosocial risk, where are these risks within our workplace, where are they within workplaces in general, who are the stakeholders when it comes to managing this stuff, and really just planting those seeds so that when we talk about psych health and safety, people know what we're talking about. It's not psychological safety, it's psychological health and safety. It's very much an integrated approach within how we manage safety in general within our organisation. So that's the journey we started, really, really very much an engaging kind of approach. Then from there, we changed our WHS, our yearly mandatory learning module, to include a section specifically dedicated to educating all of our people in psychological health and safety, and that's going to be launched this month, which is really good. So that's the first time we've gone out to all of our people with a mandatory online learning module, that, because it is still everyone's responsibility and it's just a different way of thinking about safety. So that was something that we were really pleased to be able to do. From there, we worked with our business units to establish risk registers. So our psychosocial risk registers, we've got a number of different business units. Some of their risks are really quite similar. Some of them are a little bit different. So we needed to work individually with our WHS specialists, with our risk teams within those areas, and with our operational teams to understand what are your risks, what controls do we have in place. We might not have everything all in a row, really effective controls. That's okay. How can we better understand what our risks are, and therefore where are our gaps, and how can our team help you fill those? We informed those risk registers based on some kind of consultation with our operational teams, but also because of the fact that, because we've been in this organisation a number of years and we've done so much in that mental health and wellbeing advisory training space, we spend a lot of time with our frontline. We spend a lot of time at our care homes, spend a lot of time in our contact centres, a lot of time in our dental practices, talking to our people for years and years and years. Got really great relationships with a lot of them. So we informed our risk registers based on that consultation, as well as based on with the consultations with the operational leaders. Moving forward, I think that I'd really like to have a more formal consultation at a wider level. I'd really like to see volume consultation through a psychosocial risk assessment, and also through focus groups. So a bit more formal type consultation type avenues. But that's where we're at the moment. We're also looking to implement a psychological health and safety standard within our safety system, because we want to, and we thought, do we integrate it into what we already have? But I think it's one of those things that it's important enough to call out. Business is really on board with that. So we are going to have a separate standard based on Bupa's position on psychological health and safety. And through that, we've also been represented now, my team particularly has been represented on our WHS committees, risk committees, boards. You know, it really is front and centre for a lot of our executives, and also a lot of our communities of practice and things like that. They're talking about it everywhere. So that's how we've sort of moved from a informal way of addressing mental health and wellbeing to a bit more of a systemic approach.